Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with the February 18th, 2021 update from the Dubuque County Public Health Incident Management Team. Dubuque County's COVID-19 new case trend line is trending downward, with 239 cases reported in the last 14 days. Nationally, cases have been declining for several weeks, along with the death rate. But nationally, we still had 20,000 deaths in the last 7 days. But even with that progress, the daily numbers of new cases and deaths remain much higher than the first two peaks of the pandemic in the spring and summer of 2020. And now we have the variants of SARS-CoV-2 to factor in. So far, Iowa has detected 8 B.1.1.7 variants through sampling at the State Hygienic Laboratory. So the question of the day or month is, how do I get a COVID-19 vaccine? Although this seems like a simple question and should have a simple answer, it can be quite complicated. First of all, because there's not enough vaccine to cover everyone right now, the federal and then the state governments have determined priority groups for who gets vaccinated. Dubuque County must follow the Iowa priorities, and in fact, this is an official order from the governor. Right now, those 65 years and older are one of these priorities and are by far the largest group currently eligible for vaccination. To date, the 65 and older group has received about 43% of the vaccines administered in Dubuque County. And now that we're finished with healthcare workers and long-term care residents, this percentage will grow. Teachers, school staff, and child care providers and first responders are also currently eligible, and we will be finished vaccinating these groups next week. After that, the next priority group will be manufacturing workers who cannot social distance and the disabled in home settings who are dependent on a caregiver. As with all of these priority groups I mentioned, the vaccine provider will contact you. For those of you 65 years and older, you will be contacted by your doctor or healthcare provider as they reach your age group. And naturally, clinics are starting with their oldest patients and moving from oldest to youngest. If you're 65 and older and don't have a healthcare provider, you can call the Dubuque County Vaccine Information Number at 563-587-4950 and leave your contact information. And when vaccine is available, you will be called with an appointment. Also, for the 65 and older population, Hy-Vee will be administering vaccines, and eventually other local pharmacies will have vaccines for the public too. So for those of you 65 and older who have not yet received the vaccine, you are not the only one. Remember, there are almost 18,000 people in Dubuque County that are in this age group, and only a small number have received at least one dose. So please be patient as we work through several priority groups at once. It's going to take months before vaccine is available to everyone. So back to the initial question. How do I get a vaccine? For those 65 and older, watch Hy-Vee and other pharmacies' websites to see their vaccine availability. Or wait for your healthcare provider to call you with an appointment. Or if you don't have a healthcare provider, call the vaccine phone number at 563-587-4950. For everyone younger than age 65, you will be contacted by your employer if you meet the criteria of one of the priority groups. Scheduling will then happen as vaccine becomes available. If you're under 65 and you think you're in one of the priority groups but do not work for an employer, you can also leave your information through the vaccine phone line at 563-587-4950. I know this is complicated, and it doesn't help that we get very little notice on how much vaccine Dubuque County will be receiving, and if our local pharmacies will be receiving any. So my best advice is keep checking the city's Facebook, the Dubuque County Public Health updates, and other local news outlets for the latest vaccine information. Supplies will increase. As we head into the weekend, I'm sure many of you have wide open calendars. Except for organizing some closets and deciding what's for dinner, my schedule's pretty open too. It's going to warm up a little, so maybe step outside for a walk, a hike, or visit with your neighbors. Remember, all we have is today, so let's make the most of it. And also, keep wearing a mask when you're out, stay apart from each other, avoid swapping air, especially in enclosed places, and wash your hands often because we're all in this together.